does it? Welcome back to Good Morning Arkansas. We have Dr. Justin Seale joining us right now. Great to have you on the show. Spinal care specialist over at St. Vincent's.
Correct.
Your specialty, you really focus in on patients who are 65 and older and some of the spinal care that they need. What's the most common injury that they have?
Well, one of the things we see as the population gets older, we see the weakening of the bone. As the bone gets weaker, it predisposes to fractures of the spine. We see it more in the female than the male population, but we do see a lot of fractures of the spine. They occur from falls. These are fractures that typically occur in the younger population from car wrecks or falls from great heights. But as we get older, our bone gets weak. Just a fall from standing can cause a fracture of the back.
Can maybe accidents at a younger age make it worse at an older age?
No, that is not true. That can lead to other injuries, but these fractures are due to weakening of the bone.
Okay.
So.
And for women, why is it that women tend to have more injuries than men?
Well, we know that estrogen levels affect the quality of the bone, so the females are a little more at risk of thinning of the bone due to loss of estrogen levels in later life.
All right. So what's the treatment?
Treatment is generally we try to allow the fractures to heal on their own. If the patient is having too much pain associated with that, we do have a procedure that I have a picture of that'll show that we can apply cement. The top left is a fracture. We then can place a small balloon into that fracture through a minimally invasive procedure and place cement into that fracture to stop the fracture pain. And it's about a 10-minute procedure, minimally invasive through very small incisions. But we typically try to allow these to heal on their own. We only do this when the patient's having too much pain to ambulate, to get around, to function in life.
So what can you do to prevent getting to that point?
Well, the biggest thing is if you're worried you might have osteoporosis, you want to catch it before you get to the point your bones are weak enough to sustain fractures. You can talk to your primary care physician about that. You'll learn, they can determine whether you need to be evaluated for osteoporosis or weakening of the bone and then be treated for it. Other things you can do is just make sure as we get older we don't lift our feet up. And I see a lot of older people that'll just be going to the bathroom at night and trip on a rug and stub their toe and boom, they have a fracture. So removing cords, small rugs that have lips on them, and just preventative measures around the house.
All right, what other injuries do you commonly see?
Well, we see a condition in population as we get older, we have wear and tear of the spine where nerves start getting pinched, called stenosis. And I have a picture kind of demonstrating pinching of the nerves here of the low back. And as this develops, you develop pain down the leg. Some patients, as this develops, they'll start walking bent forward, hunched forward. As this develops, they can't stand straight because the nerves become pinched. They can't walk, they can't stand because of pain, numbness, weakness into the buttocks, down the leg, sometimes just one leg.
So just leaning over relieves that pain. If they stand up, then it hurts.
So you'll see older people walking around bent forward. A lot of that is to alleviate the pressure of the nerves.
What do you do to fix that?
Well, we have physical therapy, we have injections of steroid around the spine, and I can surgically, if the non-surgical measures do not help, we can actually go in and kind of do a rotor-rooter around the nerves, take the pressure off the nerves, so that when the patient stands straight, the nerves aren't being pinched. And I actually do a minimally invasive procedure. I have with very small 16-millimeter incisions that we can go through and unpinch those nerves in about a 20 to 30-minute procedure, home the same day, over in about 2 weeks.
Oh, wow, that's pretty. I'm going to throw what about sciatica? Is that related to sciatica problems? Because I know some adults who have that.
Absolutely. Sciatica, what I was talking about medically was neurogenic claudication, where kind of all the nerves get pinched off. Sciatica is where one nerve gets pinched, and it'll cause pain shooting down one leg. And I can use this same treatment pattern for those same symptoms. Non-surgical intervention, and then if needed, surgical intervention through minimally invasive decompression or taking the pressure off the nerves.
Okay. I think, I have a ton of questions. I'm sure our viewers do as well, and they can contact you. You're a wealth of information. You're located there on South McKinley at 600 South McKinley, Suite 300 here in Little Rock. That's Dr. Justin Seale with the Arkansas Specialty Spine Center. The phone number for more information, it's area code 501-663-3647, 1-800-550-5755. 5 if you live outside that area code. And again, you have, I've got tons of questions I could probably go over and over with you. But again, you try to avoid surgery at all costs.
Absolutely. It's the last thing.
The last option.
Absolutely.
All right, but in some cases, that's the only option.
We can really improve function of life sometimes through a very small procedure.
All right, contact Dr. Justice Seale. Thank you very much for coming on the show.
Thank you.
Have a great weekend.
Absolutely.